out of touch and insult the intelligence of the American people and lived experience.
Why is healthcare in America killing people? Maybe everyone still remembers the guy Luigi Mangione. Hey, a handsome guy who grew up in a wealthy and educated family, but the boy was still willing to sacrifice a bright future and pull the trigger on a SEO poll. What does the Luigi mention mean? Since December 2024 until now, it has received a lot of comments from beloved readers about a video exposing the truth about the painful insurance problem in the US. And after a period of research, this clip was formed, and we are here today. And without wasting much of everyone's time, let's get started with today's topic. In America, there is a famous joke that it is best not to get sick or you will be sick forever. But that ironic saying is 100% true. In the United States, a middle-class family, if unlucky, can be completely defeated when family members fall ill. Medical expenses in the US are truly a nightmare for those from the middle class and below. Perhaps some of our beloved viewers have heard the story of male singer Dam Vin Hung seeking medical treatment in the US. During one of his shows for Q Bao Sa Su, the talented Trong suffered an unexpected leg injury, and like everyone else around the world, he was taken to the ambulance and taken to the hospital. And you can guess how much the treatment and hospital fees for a case of losing a toe like Dam Vin Hung's would cost. The male singer had to spend about 800,000 USD to transfer to the hospital's account. That's why very quickly after that, Mr. Dam quickly flew back to Vietnam to recuperate. If he stayed in this country, he would soon be in trouble. Of course, information related to this singer is often exaggerated to expose his reputation. However, the fact that hospital fees in the US are expensive is clear as day. With the characteristics of a capitalist country from the beginning, medicine is also a business. Therefore, it is natural that hospital fees are expensive, and even especially expensive when it comes to needing qualified doctors. To become a medical worker in the US, a doctor requires a huge amount of money to cover 10 years of study and internship, along with countless other expenses. And so the salary of a doctor in the US is also said to be staggering, even when compared to the average level of developed countries. And even this number is quite different many times. The highest that can be calculated is the income of emergency doctors and surgeons, because these specialties cannot open their own clinics. Therefore, the average annual salary of emergency doctors in the US is around 310,000 USD. This number is much higher than the average in other developed countries, such as Belgium, Finland, and the Netherlands, ranging from around $160,000 to $200,000. Even nurses who don't require as much expertise and training as doctors do earn very good salaries in the US. Nurses in the US earn more than most of their counterparts in other developed countries. The average salary of a nurse in the US is around $77,600, while the same figure in Australia or Israel is around $50,000. With such high salaries for staff, it's no wonder that hospitals in the US will push you with huge bills, even for routine tasks like X-rays. In Vietnam, this figure ranges from $50 to $200 depending on the department. That's pretty similar to what my friend in Spain pays, which is $80. Meanwhile, every time you go into the X-ray room, a $600 bill will immediately hit your head. Just hearing about it makes you breathless. Giving birth in the US is also incredibly expensive. If you immigrate to give birth in the US to get citizenship, take the time to exercise and strengthen your wife's hip muscles regularly so that your child can be born naturally. Because every time you touch on a cesarean section to bring your child into the human world, it will cost about 20,000 USD. Not to mention the fact that the cost of medicine in the United States is among the most expensive in the world. But this will be better explained later, so keep that in mind. I will come back to that issue later. But in short, the average American has to pay twice as much for medical services when compared to other developed countries. In general, the top one is unmatched. Yes, so why hesitate to buy insurance? With such a thoroughly commercialized medical system, insurance seems to be the only salvation for those in the middle class and below.
And I was making it clear to the president that he has no mandate to cut Medicaid. I have people who are very fearful. These are poor people. and they have only Medicaid in their lives when it comes to their health care.
Okay, and now we get to the real drama. This is what Congressman A.L. Green told the media after being ejected from the House floor for interrupting President Donald Trump's speech. At first glance, Mr. Green seems to make sense. It's obvious that protecting the money flowing into insurance coffers like Medicare, Medicaid, and Social Security is a good thing. Now let's analyze it slowly, and we will gradually be able to reveal their nature. Basically, Medicare and Medicaid are both insurance aimed at protecting the health of vulnerable people in society. If Medicare is aimed at the elderly post-retirement group, or specifically over 65 years old, Medicaid is aimed at the low-income group. Meanwhile, Medicaid is free once you qualify and prove that your income is within the poverty line in the state you live in. Meanwhile, Medicare is a bit different and much more complicated. This insurance includes 4 levels of service use, classified into tiers B, C, and D. I will give an example to help you visualize. Level A is also the basic level, and patients will be exempted from inpatient hospital fees, regular health checkups at home, and care for terminally ill patients. It sounds quite interesting and generous, right? But in fact, it doesn't. Level A does not include payment for doctors' treatment and medicine, which means patients still have a lot to pay. What do you expect if it's free? Now, if I want better protection, I have to upgrade, right? Of course. So now if I want to be supported to pay for doctors' fees and medicine, what will happen? To do that, you need to buy insurance up to level D with the total amount from all 4 levels A, B, C, and D, which is about $400 per month. Each number is actually not small at all. However, the real sad thing is the confusion of Medicare and Medicaid, because in essence, it is a program that is funded by federal funds and people's tax money. Every month, Americans' accounts are automatically deducted from taxes, and a portion is put here. The fact that vulnerable people still have to pay not knowing the money to buy them back is no different from a farce. And that's not all, because when it comes to federal funds, no one cries over public funds. These types of funds are extremely easy to exploit to become milk for greedy people. The 8-year period of Obama's administration was the period when Americans had to witness the most scandalous things. In 2011, the FBI, under the direction of the federal government, discovered 111 people who took advantage of Medicare to gain personal benefits with a figure of up to $2.5 billion USD. With a series of unreasonable false test bills and fake medical equipment purchases, they have been embezzling from this insurance fund for many years. Not only that, they also discovered that up to 1,500 employees under Mr. Obama's command received collective subsidies. No matter how strong and wide, there is no shortage of any part. The tricks of this group are quite easy to understand, but extremely effective. First, the Medicare and Medicaid hawks will approach hospitals and especially greedy doctors, then bribe and promise generous bonuses. From there, the doctors will list bills from medicine to unnecessary tests and equipment. Not only that, relying on the fact that remote treatment is quite developed in the U.S. Thanks to that, these witch doctors are free to convince patients with fake medical records. They took advantage of the panic of people with constant health concerns to make millions of dollars from medical device sales. After patients sent in bills to Medicare for payment, these funds were quickly transferred back to hospitals to be laundered into clean money. Meanwhile, patients received ineffective placebos and useless devices to treat their illnesses. But that was still lucky, because many greedy doctors have killed countless people by deliberately prescribing painkillers innocently to inflate bills and then take the difference from insurance. The government arrested the doctors who doused themselves in eucalyptus in Michigan in 2017. Under orders from President Trump, the investigation uncovered horrifying secrets. These evil doctors deliberately prescribed unnecessary painkillers to patients and received nearly $200 million from these prescriptions. Even more frightening, they continuously smuggle poor quality products along with highly addictive painkillers, such as oxycodone. Every time they use them, patients will fall into a spiral of dependence and will be unable to escape the web created by these people. The above scandal has contributed to the addiction situation in the U.S. According to the authorities' accusations, because of oxycodone overdose, every day about 91 Americans have passed away forever. and millions of others are living half dead because of addiction to this painkiller. And when it was discovered in 2017, people were shocked to realize that this network had existed and been operating since the Obamacare program was first conceived. In addition to this simple form, they also have some more sophisticated tricks to profit from Medicare and Medicaid insurance. By luring gullible elderly patients from telemedicine services, they lured many elderly people into believing that they had incurable syndromes, from which they wrote payment requests to insurance agencies. The most important thing in this form is to need an intermediary to produce medical equipment, because this person can manipulate the price of supplies with just a few strokes of the pen. This is Andrew Kremiel, one of the most talented Medicare and Medicaid exploiters. Owning more than 10 medical equipment manufacturing companies, he sent Medicare purchase orders for unnecessary equipment for patients worth more than $300 million USD. And naturally, he did not stand in his name for any transaction. But all the directors of the subsidiaries received the money to share. And so it was like a cruel death spiral. The US government lost millions or even billions of USD over many years. In addition, because Medicare's budget is drawn from income tax, this means a shortage of funding for other public services that are more necessary for the people to compensate for the above losses. Insurance costs will increase while benefits for users have decreased. So it is not surprising that our beloved Congressman Al Green does not want this model of Medicare and Medicaid to change at all. Because for the past decade, Mr. Obama has built for the Democratic Party a seemingly endless money-sucking machine. Now that this nest has just gone, the sky will surely fall for them. What about you? Have you ever thought about going to the US for medical treatment? Let's chat in the comment section. Now, goodbye, and see you again.